And a tool that makes healthcare more accessible, cost-effective, and that increases patient engagement is telemedicine. Patients that reside in rural areas that previously had difficulties accessing a physician can now reach them virtually. Physicians and patients can share information in real time from one computer screen to another, and they can even see and capture readings from medical devices at a faraway location. Using telemedicine software, patients can see a doctor for diagnosis and treatment without having to wait for an appointment. Patients can consult a physician at the comfort of their home. And founder and CEO Tremendoc Limited, Chikezie, joins us on the news at 1 for an expert view on this. Good to have you join us, Chikezie. Now, as governments around the world begin to reimagine healthcare delivery in the face of COVID-19, many people say that telemedicine might just be the game changer. Tell us about that.
Yeah, hi, nice to be here. Telemedicine, of course, is the game changer, especially in this time. Telemedicine has been around for a while. It's common practice that has been happening, but people have not really noticed that they've been practicing telemedicine for a long time. I say to people that if you have a friend who is a medical doctor or a relative who is a medical doctor, and when you feel a certain type of way, you call up this friend or relative on your phone, and he's able to diagnose your symptoms and prescribe certain drugs to you, and then you feel better. That act right there is telemedicine. So at this time, telemedicine is really very useful because people are afraid to go into the hospital for fear of contracting the coronavirus. So it's actually possible that you can consult with a licensed doctor mostly for telemedicine.
All right, so you say that really the healthcare system around the world is overstressed, so a lot of people would rather not go to the hospital for fear. But countries like Australia and Singapore are quietly encouraging telemedicine as part of their COVID-19 response strategy. So why are we not seeing equivalent efforts across board?
I think that the country itself is just being introduced to telemedicine. Like I said, all around the world, telemedicine has been around for some time. Tremendoc, for instance, started 3 years ago, but it was hard trying to educate people about telemedicine and the need for it. And that's why today, because that education is really low, a lot of the citizens do not really even understand how telemedicine works. And I guess that is also related to the government as well. But we've seen for Tremendoc, we've seen a lot of partners like banks, some other big governments having conversations with us, saying how they can deploy it to their citizens. Some banks have already made it to customers. So I think it's a kind of process, and somehow.
So just allow me butt in here, because you mentioned Nigeria, you say we've always been doing that, but we know that scaling up the implementation of telemedicine will require coordinated efforts between the government, tech firms, and healthcare providers. So how do we overcome the barrier in all of this?
Yes, so I think you've answered your question. It's a collaborative effort. The government should see the existing telemedicine platforms as a leadway, because they have already been in the system and have already deployed this solution, and come to us and see how that education, they have a network of channels where the citizenry can be educated around telemedicine, subsidize the cost that we have, because we also pay doctors per consultation when they use this platform, or when they consult with patients on this platform. Work with us and see how we can deploy this solution across Nigeria, even to the rural areas. So that's basically what it is. We're also working with hospitals and let's say regulators as well, to see how we can push this to the patients who are coming into their facilities, and they still get access to their doctors as well.
I'm afraid we do have to leave it there. Many thanks for sharing your perspective with us. Founder and CEO Tremendoc Limited, Chikezie.